Does wearing a chastity cage cause erectile dysfunction? It's a question more people are asking, and it deserves a clear, honest answer. Before we get into it, this video is for general information only and does not replace advice from your GP or a sexual health professional. If you have specific concerns, please speak to a healthcare professional about your situation. Right? Let's look at what the evidence actually says. A chastity cage is a physical restraint worn around the penis, typically made from medical-grade silicone, stainless steel, or polycarbonate plastic. It encases the flaccid penis in a restrictive tube secured by a ring at the base. When arousal occurs, the device physically limits expansion. It's worth knowing that these are consumer products, not MHRA-regulated medical devices, so safety and quality can vary significantly between manufacturers. Now the big question, can wearing one cause erectile dysfunction? The honest answer is that evidence directly linking appropriate short-term use to permanent erectile dysfunction is very limited. But that doesn't mean there are no risks, and there's an important distinction to understand here. Temporary functional changes are not the same thing as true erectile dysfunction. After removing a chastity device, some people notice reduced rigidity or slower arousal. Research suggests these temporary changes typically resolve within hours to days. The key word there is temporary. That said, physical risks do exist, and they become more significant with improper sizing, extended wear, or poor hygiene. Circulatory compromise is a real concern. If a device is too tight or worn for too long, blood flow can be restricted in ways that go beyond temporary discomfort. Skin complications and urological issues are also possible. Psychological factors matter too. Performance anxiety and changes in arousal patterns can temporarily affect erectile function, even after the device is no longer being worn. So the impact isn't always purely physical. If you're using or considering a chastity device, it's worth having an open conversation with your GP or a sexual health professional. And if you're already experiencing erectile difficulties that have persisted for several weeks after stopping use, that warrants a GP assessment. Your doctor may refer you to urology or psychosexual services depending on what's going on. Don't put that conversation off. These services exist precisely for situations like this. Now, when should you seek urgent help? If the device cannot be removed, seek emergency medical attention immediately. If you notice severe discoloration of the penis or surrounding tissue, that's an emergency. And if you experience complete urinary retention, meaning you cannot pass urine at all, go to A&E without delay. You can also call NHS 111 for urgent advice. These are not situations to wait and see with. To recap, evidence linking appropriate short-term chastity cage use to permanent erectile dysfunction is very limited, but temporary changes and physical complications can occur, particularly with poor fit, extended wear, or inadequate hygiene. Psychological effects on sexual function are also real. And remember, these are consumer products without specific medical device regulation, so quality varies. If something doesn't feel right or difficulties persist, please speak to a healthcare professional. There's no need to manage this alone. If you found this helpful, leave a comment below. And if you'd like more straightforward health information like this, give this video a like and subscribe to the Bolt Pharmacy channel.